I'll start with that last part of your question first. People who are unvaccinated are much more likely to get a disease than people who are vaccinated. So if that disease is in the community, like when flu is spreading during the winter, people who have their flu vaccine are much less likely to get sick than those who don't have their flu vaccine. So different diseases are different. So for example, for measles, if someone has had measles and that was diagnosed by a doctor, or they show evidence when we draw their blood that they've had measles, they have protection against measles. That protection came with a risk because when they were sick, they could have had complications. So they wouldn't need another vaccine. But for diseases like flu or COVID, we can get them more than once. So having the recommended vaccine will offer you continued protection and make sure that when you come into contact with that infection, that even if you get sick, you're much less likely to be seriously ill or need to kind of go to the hospital or have any complications. So, if you have questions about whether you need a vaccine, talking to your healthcare provider or your doctor is the best way to answer those questions, but it is different for different vaccines.